Welcome to Four Quarter Lives, a podcast exploring the profound impact of longer lives and careers on everything: countries, companies, couples, and careers. I'm Aviva Wittenberg-Cox, and on this week's Four Quarter Lives, I talk with Dr. Mileham Hayes, an 84-year-old longevity trailblazer who has spent more than 5 decades on the front lines of preventive medicine. Long before longevity became a buzzword, Dr. Hayes was quietly pioneering its principles, setting up Australia's first longevity clinic back in 2000, advocating for proactive diagnostics, and urging patients to take care of their health. In our conversation, he shares short, sharp, data-driven insights from his recent book, Longer Lives, a no-nonsense guide to avoiding premature death by naming the simple but neglected things that really matter. We cover the tests everyone over 40 should demand from their doctors, why most heart disease remains tragically under-prevented and preventable, and why the health industry still profits more from sickness than wellness. With warmth, wit, and a dose of Australian irreverence, Dr. Hayes debunks fads, questions pharma, and offers up the ultimate common sense plan for living longer and better. Welcome, Dr. Mileham Hayes, to Four Quarter Lives. Nobody could be more relevant to this topic.
Thank you, Aviva.
So, Mileham, I wanted to have you on this podcast just because, not only do you practice what you preach, but you're kind of proof in the pudding that your advice might be worth listening to at your age and stage, and having worked and followed the issues of healthy aging for all of a very, very long career. I think you have a very honest and no bullshit kind of approach to how do we live longer and healthier. So let's start there, perhaps, a little bit with your professional origins. You are a pioneer in this space. You set up the first longevity clinic in 2000. What sparked that early interest?
Probably before that, Aviva. Funnily enough, it was in England that they first proposed coronary care units. But as of now, the NHS was broke. And so they approached a Sydney physician called Gaston Bow at Sydney Hospital, and he took it on. And by a fluke, I wanted to become a physician, and I was in another state, and so getting into Sydney Hospital is more than prestigious, but by a fluke I got in there and was appointed to the first coronary care unit in the world.
In Sydney, in Australia?
Yes.
Okay.
Yeah, in 1968. And at that stage, everything was incredibly both primitive but also avant-garde. The nurses we had to get from America, and they'd ring you at 4 a.m. and say, "Hey, doctor, we have a patient here with crushing chest pain with throwing off 1 in 6 idioventricular arrhythmias. We were wondering if you could kindly come down." And I invented a boiler suit and scuffs so that I could jump out of bed and run into it, run into the scuffs, run into the coronary care unit, where at 4 a.m. every night I had to go out and say, "This pretty young thing with 3 little kids hanging onto her skirt, I'm terribly sorry your husband didn't make it." And maybe I could sue for PTSD, but doctors aren't allowed to get PTSD.
You've been more than a half century on
57 years.
Healthcare. What's changed and what hasn't, and why not?
I think the incredible thing as to why not is in 1968 I realized that this was preventable, and 80 to 90% was preventable, and it still is, but it's not.
Heart disease.
Our greatest killer throughout the world is heart disease.
For all of these intervening 57 years.
Yes, and preventable. Would I find it irksome, bewildering? The answer is yes. Being a selfish male chauvinist pig, I've looked after myself. No, I have also looked after my wife and my patients. But I
But
started.
you are proof that you might have figured something out about keeping a
I
healthy
think so.
heart.
I was doing tests in 1990, which are just now becoming the gold standard, but still not universal, much to my bewilderment. I was speaking to some so-called experts today, some pathologists trying to refine my health clinic, and they didn't know what I was talking about, which is spooky.
That is a bit spooky. So what are they talking about, and what tests aren't they doing that they should be doing?
Well, when I started, cholesterol was obviously becoming the big thing. There was a town in New England in America called Framingham, and that's what I based everything on. It's a very famous study. They divided the town into two, and they worked out that, yes, cholesterol did seem to be a problem, but there wasn't all that much we could do about it. I can remember being sworn off mud crabs and prawns and yet Ansel Keys had shown that dietary cholesterol has very little to do with our own cholesterol. And so in 1987, the Japanese invented statins, and that revolutionized lowering cholesterol. But testing of it was called LDL, lipoprotein C, was the naughty one.
That's
And
all I know. Good cholesterol and bad cholesterol. That's as
that's right.
far as most lay people get.
Okay. LDL-C is the bad cholesterol.
Oh.
But they test it in two different ways, and most of it is a derived and not a direct measurement. No one tells you this. And then as the protein and the lipo is the cholesterol, and the protein is what transports it around the body. So lipoprotein C gets into your coronary arteries and deposits these atheromatous plaques that block it and give you a heart attack. But the atheromatous plaques are made up of a subfraction of LDL-C called ApoB. And I started to do ApoB in 1990, and it is the definitive test. And I am happy to say I've monitored mine and kept it low.
Is that now widely accepted that ApoB is the key test that we should all be tracking?
Let me say it should be.
Okay, but it still isn't.
No, it's not. And it's bewildering to me.
Okay.
Because there have been some eminent studies in 2000 and 2012 corroborating what I found. And then another one, however, was another test called Lp(a). Now, this sadly is genetic, and there was nothing we could do about it. Statins don't affect it. And nevertheless, I thought it beholden to do it on my patients, because you could at least scare them into
doing everything else they could. Yeah.
Exactly that.
Yeah.
So anyhow, lo and behold, my wife has Lp(a). Now, she's as fit as a trout, or I don't know, and slim and did. And so it's very annoying. But they have now found about 6 marvelous medications that will lower it by 90 to 100% without any side effects. And they should be available next year. So that's wonderful. We can now, in my opinion, the other thing was doing coronary artery calcium. This, again, I was doing this in 1990. I can remember when I was a medical student, I was a counter jumper in one of our big stores, and my other counter jumper ended up starting one of our big radiology departments. And I went and saw him in 1990 or earlier to work out how to do coronary artery calcium. And he's laughing and saying, we're muddling about, really. But I started to do them then, and now they've been sort of the definitive basis on the other side of things. So you do your cholesterol and your coronary artery calcium, and that'll tell you if and when you should have statins 10 years prior to when we have been prescribing them. Now, I wouldn't mind a 10-year start.
Yeah, that's a good way to go. And I mean, your book, Living Longer, is all about if I had to summarize the sort of take home, it was forget all this life extension pushing of weird ways to make us live many decades more. Why not focus on the things that are massively still killing us today that most people are unaware of, untested for, and we could eradicate an awful lot of foreshortened lives if we paid more attention to what we already know. Is that a fair
Absolutely. Yes, very, very fair. And it might sound trite and silly, and I do it deliberately. You can't live longer if you're dead. So the first thing is to do, surely, common sense, is not to die. So how do you go about that? Well, you identify the risk factors. Okay, now we can't choose our parents and all those funny ones, but there's so many more things we can do. And the first thing I think we've got to do is prioritize health. We prioritize our cars, our where we live, our holidays, and You cannot enjoy these if you are chronically ill, let alone dead. So health must be number one.
So health, absolutely, but also you're talking about really focusing and prioritizing on the biggest killers for the age that people actually are. So give us a decade by decade list. What are the biggest killers from the 40s onwards? 40s, 50s, 60s, 70s? And is there a big gap or difference between genders?
Yes, there is, Aviva. These official government statistics from the USA, the UK, and Australia.
Yeah.
Now, for men, I don't know why men and women age groups, you'd have to ask the civil servants why they have different age groups, but men in the USA, age 35 to 44, the first greatest cause of death is suicide, then poisoning, then coronary artery disease, then road traffic accidents, and then homicide, bang, bang, gun. In the UK, it's 35 to 49, suicide, heart disease, liver disease, accidental poisoning, and then cardiovascular disease. In Australia, it's number one is cardiovascular disease, cancer, accidents, digestive diseases, and then chronic lung diseases. But for women in that same age group...
That's a very daunting positioning of suicide in the US and UK above heart disease.
Well, it is, isn't it? And somewhat sort of out of left field, a bit alarming. One wouldn't realise this. Because in the overall thing of what kills us and all the big lists, they're totally different. They are coronary artery disease, dementia, cardiovascular disease, lung cancer, chronic obstructive pulmonary disease. Yeah. Suicide doesn't get a mention. And so we come to women. Now, starting at 45 to 64 in the USA, it's breast cancer in USA, breast cancer in England and Wales, and coronary artery disease in Australia. And then in America, it goes down to heart disease, unintentional injuries, chronic liver, and lower respiratory tract. Whereas in England, it's breast cancer, liver disease, accidental poisoning, suicide, ischemic heart disease. Whereas in Australia, it starts with ischemic heart disease or coronary artery disease, lung cancer, breast cancer, suicide, and cancer of the colon. And so these are totally different from the big things, the United Nations list of coronary artery disease, dementia, cardiovascular disease, lung cancer, etc. And so identifying what is going to kill you for your age and sex, I find, has been very, very useful for keeping my patients and myself alive.
Yeah, focus on and interesting cultural differences there, that it should be, those lists are actually quite different by country, which is slightly bizarre.
Quite different, yet quite similar.
Yeah.
Obviously the gun lobby and the drug culture in America, it's bizarre.
Yeah. Yeah. Well, the suicide's up there in the UK too, which is no gun lobby and Anyway, those are very daunting figures. So, okay, back to what we can prevent. I assume that suicide will be a different prevention track than our physical ailments.
In as much, I think, if we're aware of it.
Yeah.
As a medical student, I can remember some wise doctor just holding my elbow saying, beware the smiling depressive.
Yeah. So you have actually prepared for us that people can download this list that sounded a bit complicated as you were reeling it off, but decade by decade, a kind of hit list of what might kill you most and what you should focus your preventive efforts on as age and by gender, which is different. So you argue that despite decades of awareness, we've made what sounds like very little progress on heart disease across any gender. And I'm just curious, why not? What do you think is standing in the way? You've been on this for almost 6 decades. What are you bumping up against in getting rid of this, especially since the tests are now sounding like they're more widely available?
Well, that's a great mystery. I don't know. But in my book, I pondered this, and I think doctors are about only the 7th person to have any influence on health. I remember watching a BBC interview with, I think, a Plymouth physician, and he was very excited that they were going to release, I think, the Royal College of Physicians, a survey on fast foods. And they interviewed the then Minister for Health, who, from memory, and don't quote me, was a woman, and I don't know which party, and she was quite keen. And then apparently the fast food lobby went and saw her and said, Minister, unfortunately, our soft drink factory is right in the middle of your electorate. And of course, if this report is published, there'll be a loss of 5,000 jobs. And in brackets, of course, in parentheses, and you'll lose your seat. So the report was never published. So this is the list of what affects our health. Government, insurers, hospitals, drug companies, big pharma, the food industry, the tobacco industry, the media. And coming in at 8 is doctors, 9 allied health professionals, 10 health workers, 11 patients, now called consumers. And then complementary medicine, lifestyle, longevity clinics, business, and supply and service companies. So there's so many people after the health dollar. And the doctors and the patients are minions, small players in it. We're being manipulated left, right, and centre. The health dollar is the fast food industry has more money than most countries' budgets.
Right. So just a huge challenge because most health systems in all the countries you're talking about are now saying they've got to move from a sick culture to a preventive culture in the face of longevity and aging societies. Otherwise, they just can't afford what's coming down the pipe. But what you're saying is the 8 institutions or 7 institutions above doctors don't necessarily have that as their priority.
Oh, not at all, not at all. And
they make a lot of money off us being sick and a lot less if we're healthy. Is that the bottom line?
Yes, without a doubt. And the government won't bite the bullet and fund preventive medicine. They'll do, publicity stunts, but they won't pay for screening tests, etc. What I do find encouraging, though, in the NHS in Britain is they are contemplating funding these GLP-1s, the Zempics and the Mounjaro to reduce obesity, which I think will be fantastic.
Yeah.
And that is preventive medicine, practical preventive medicine.
Yeah.
And if that goes through, they're to be congratulated.
Okay. And beyond the GLPs, you're advocating a 20-test longevity screening battery. Tell us about that.
Well, I'd like
Where
to
did
look
it develop? And we'll also put this list as a downloadable in the show notes.
I'll have to send it to you because I have to look it up each and every time. But it breaks down into three.
You don't need to give me the full 20, but give me the top
no.
five. What's the top 5 most important things that anybody over 40 listening to this should just go and knock on their doctor's door and say, I want this test done?
I think you get your full blood count, your electrolytes and liver function tests, and your lipids, coronary artery calcium for women, of course, mammograms. And if you've got dense breast tissue, you must get a CEM, which is a contrast enhanced mammogram, because it picks up 4 more cancers than the normal mammogram. And thereafter that, you can do like your thyroid function tests and your male and female hormones and other things. But I think those are the main ones. Your full blood count, your MBA, which is your electrolytes and liver function tests, your lipids. And in the lipids, you've got to do those other ones I talked about. And a coronary artery calcium.
FOB and LPA.
Exactly that.
Yeah. And how often do you have to do this?
Well, the
here,
LPA.
Here in the UK, they do mammograms every so often, and they do bowel cancer, and you get a certain number of tests, but it's like every 5 years, I think, especially as you age.
Thank you for reminding me. In that test, you've got to have a low dose CT scan of your lungs and a FIT test, which is a test for blood in your feces, coronary for colon cancer.
Yeah.
How often? Well, the LPA only once in your lifetime.
Right. Yeah.
and
that's genetic.
The others, if they're all normal, every 5 years. If they're abnormal, every year until they're normal.
Right. Okay. So is this really what longevity clinics are today? Is this what you have done for the last 2.5 decades in your longevity clinic? Is these kinds of just tests, tracking, and then lifestyle adaptations to get the measures back in line if they're off?
I've been doing it for 57 years in private practice. I was just automatically writing these out and getting the patients to do it without telling them. No, longevity's just been discovered.
So it's just a new word on an old practice. Was this more generalized in the past and now the tools and tests have evolved, or is this actually a new science coming along? And what do you say to all the people who want to focus more on aging as a disease itself than on separate chronic diseases that you say we're all dying from?
Well, the WHO recognized aging as a disease recently. I'm not too sure about that, but longevity has become the fad. Medicine has fads. In the 1930s, it was tonsillectomies, and then that dreadful thing, frontal lobotomies and all that. All dreadful, dreadful stuff. But now you get what I call the male menopause syndrome, these middle-aged 50-year-old men who are balding, and they've got the trophy mistress and the sports car, and they're billionaires. Well, this is cruel and a characterization, but they've invested billions and billions and billions into longevity centers, all wanting to add on to life and even make themselves immortal. Whereas I think, as an offshoot of this, all these scammers have evolved. They have, in your lunchtime in New York, you can go in and get a drip and have IV vitamins put in. You can have a ketamine hit. You can have hyperbaric oxygen and alkaline or acidic water. I'm not sure which is which. And, of course, Gwyneth Paltrow will give you a green jade vaginal egg. I'm thinking of buying those and promoting those for prostate cancer because they're not selling too well over there. That's a joke, by the way.
I can imagine. I'll tell Gwyneth. She'll be pleased.
And so, it's ridiculous. Here we have the king, the ex-president of the United States, they've got cancer of prostate. For goodness sake, what's going on? And it was self-evident to me.
In that they should have been diagnosed and tested much earlier, and this could have been avoided.
Well, I wasn't there. Silly of me to be so presumptuous.
Yeah.
I could not for the life of me. I was watching Biden a couple of years ago, and I just said to my wife, that man has Parkinson's disease until proven otherwise. And if I hadn't diagnosed that, I would have failed my exams for the Royal College of Physicians. And the fact that they kept the poor man shuffling along, because part of Parkinson's or presenile dementia, Parkinson's is one of 7 dementia diagnoses, is called propulsion. And when these people start to walk, they can't stop shuffling forward. And it's one of the diagnostic points. And politics, by cripes, that's was amazing. They kept him going. And then I look at, what's his name, Trump. Now, he's almost the metabolic syndrome. He's overweight. And if he were one of my patients, I'd say he's a heart attack waiting to happen.
So prostate, you didn't put that prostate cancer. Is that one of the big killers on the list?
No, it's not. No, absolutely not.
It's just come, but it hits a hell of a lot of men over 50.
Well, it's said that every male over 90 will have prostate cancer. There are 2 sorts, the benign and the patient dies from something else, or the nasty one that metastasizes, which Biden's obviously got in his bones. That's too late,
In the battery of tests, can this be diagnosed? When? And what decade are we talking about here, starting to pay attention to prostate issues?
Well, it's pretty low down on the list, prostate cancer.
You mean the nasty kind? Since don't a lot of men get prostate? I mean, isn't it a pretty high incidence of prostate cancer, benign or not?
The first thing's called benign prostatic hypertrophy.
Yeah.
This may eventually go into cancer. And the first thing is having to get up at night to void. And that should be the first thing to alert you. The problem is there's not a good specific test. There's one called the PSA, prostate-specific antigen. And if it's elevated, it is not diagnostic of cancer. So if it's elevated, what do you do? Well, in my opinion, at least you've got to try. And now you can do an MRI. And, I've done my PSA for, the same 50 years, and it's a straight line. So I'm pretty happy. But I would think that I'm starting, now that I'm 84, to develop hypertrophy. And this is normal. But I think I will probably die of heart disease rather than prostate.
Okay.
And as I said, every man will get prostate cancer.
Okay. Gentlemen listening, this is something we got to get our minds around.
Well, they've got to go and get the PSA done at least once. And then, if it's high, get it repeated every year. And if it's going up, that's the secret,
So changes in PSA rather than the straight lines that you're modeling for us is what you got to keep in mind. Okay.
Mine is 1, and I was at a school reunion, something I never go to. A mate of mine. But
at your advanced age, you decided maybe it was time.
Yes. A mate of mine.
See who's left.
Yes, exactly that. A mate of mine who I was at prep school with, he came up, and of course, doctors are free hits. He came and said, my PSA is 30,000. And I said, I didn't say anything. I said, well, this is the last time I'll see you, old boy. Yeah.
Yeah. Okay, so men are all going to get prostate cancer. And you've flagged, let's talk about dementia and gender and diagnostics. Because you flagged that dementia hits women much more than men. So if men are going to get prostate, it may not kill them. 2/3 of dementia patients are women. Is this biology, failure to diagnose, anything we can know or do ahead of time?
I didn't know it was 2/3. It's certainly a female preponderance. And no one knows, to be honest. It is a problem yet to be solved, but there's a great deal of work going on. All I can think is it's rather like your muscles. You use it or lose it. If you don't use your brain, then the brain consumes more oxygen than any other organ in the body. And if you can stimulate your cerebral blood flow by exercise, by mental achievement, maybe this will help clear the amyloid and the tau bodies. And that's all I can offer. But you must not smoke. I mean, number one, if you ask me, the two major things for what we should do is we should monitor our blood pressure and not smoke.
Okay.
And why women get it more, I do not know. No one knows.
Okay. We'll come back to that one day. Now I want to go on to, you've written a whole book about food and what you call nutrition in EW versus pharma and pills. You favor oranges over pills and sardines over supplements. What's the core nutritional philosophy, and why do you think people struggle so much to follow basics?
Much to my delight, just now, and I think April, there's a lovely article out of the University of Belfast, the University of Western Australia, where they examined, 250,000 people from the UK Biobank.
Yep.
And they came out and said, I think I've even got the article here, yes, a high diversity of dietary flavonoid intakes is associated with a low risk of all-cause mortality and major chronic diseases, reduces all-cause and chronic diseases by 20%. Well, I'll be in that. And thanks, chaps, for reviewing my book. Not really, but that's what I said the decade before them. And to me, evolutionary wise, what made humans the most successful animal on Earth? Well, we wandered around. We were opportunistic omnivores. We had to eat what we could when we could. Droughts, pestilence, famines, or you couldn't be a vegan going to your favorite,
Coffee latte shop.
Oh, yes. And an orange, it took 3 centuries for the penny to drop that there was something in oranges that stopped scurvy. And so vitamins are deprivation illnesses. If you're not getting them, it's pretty obvious. Anyhow, oranges and citrus have a great amount of vitamin C, but an orange has 49 other ingredients. Now, for goodness sake, are you going to take one tablet of vitamin C made in a factory or take something that humans have been taking for 600,000 years to make them evolve into the alpha predator, because these other 49 micronutrients must be doing something? That's my theory, and that's why I wrote the book.
You're really preaching fresh and diversity, lots of different things.
Exactly.
Very aligned with this whole new Zoe program I'm sure you've heard about here in the UK, where they're measuring our microbiomes and telling us to eat more of everything different. 30 vegetables a week they want, or some such thing. Would you align with that?
Well, again, I'm a bit of a skeptic because they're selling their supplements and they're making money. And guess what? They found that their supplements were ultra-processed. As soon as you get commercial inroads, I know, he's a professor of genetics or something. I don't know. And I'm also skeptical about the microbiome. Changes every time you eat. And getting on a hobby horse here, I think you have to be a clinician, and you've got to not just dispense stuff over a counter or treat your mice and your dogs. You have to be responsible that you're writing the script and telling the patient, your patient, what to do, and you're responsible for them. Now, to start a health food company and to give out random advice, I find, I'll watch with interest.
Okay.
And also, a lot of these doctors are not clinicians. They're epidemiologists, they're geneticists, And I've had enormous problems in the last week trying to talk to a radiologist or a pathologist about some latest tests. It's a great new test for an MRI of the heart out of Dundee. Can I talk to a radiologist? No, they're hiding in their little caves. They can't go out in the sun. They shrivel and die. And the pathologists are the same. And, they just found that 2 copies of a hemochromatosis gene doubles the rate of dementia in men. So I ring to say, hey, guys, do you do this test? And I couldn't speak to one of them. Now, medicine has changed. When I first started, I could ring the guy that started one of the biggest pathology companies in the world. He's a Greek doctor called Nick Nicolaides. And I'd ring Nick and say, now, what about this? Now I've got to speak to some PR guy.
Really? Interesting. Yeah.
And so these people are not clinicians and they hide, but they dispense their so-called wisdom.
Okay. So really, your books, your argument are a pretty common sense, come back to basics, understand what's going to kill you statistically, and then go about a preventive program to address the big killers. If you could hand every listener a one-pager entitled How Not to Die Prematurely, what would be on it?
The first thing, to prioritize health. Second, to accept personal responsibility. Now, some of my patients say, how do I? Say, well, what you do is you stay at home and I'll get out the roller and come around and pick you up and take you around and pigs will fly. Yeah. You've got to do it yourself. And if you want to go to Spain for your holidays rather than doing your blood tests, so be it. I can't fix that. But I would prefer to get my health sorted before I indulge anywhere else. So you got to prioritize health. Then I think if you're younger and, we're meant to be at our healthiest age, 10 or 11, and that's, gosh, if we could only get kids under healthy nutrition then, as in Japan, rather than these sick. Everyone talks about a healthy breakfast. This was an absolute confidence trick. It was done when the Idaho pig farmers were going broke. So they got Sigmund Freud, the psychiatrist's nephew, who was the first PR man in America, and they said, help us. So he blackmailed 5,000 American doctors to come out and say, breakfast is the most important meal of the day. Absolute nonsense. And then, hey, guess what? Guess what the best breakfast is? Bacon and eggs. And the Idaho pig farmers made money. Yea, verily. And no one seems to understand this. It's a confidence trick. And yet I still see BBC health programs sort of saying, oh, yes, you've got to have a good breakfast. What is a good breakfast? Most of the labourers used to get up and go out and work and then maybe have a ploughman's lunch, which is an onion and a bit of cheese after working very hard. Did. And so we've got to start off having healthy lifestyle and good nutrition and exercise and watch our weight and live in a non-toxic environment, which is increasingly difficult. And, with all the diesel fumes, blah, blah, blah. And I'm even a little bit annoyed at the intrusion of noise. I think this will become more and more apparent. And then finally, I also do skin. And one of the things I say, early to bed, early to rise, work like hell, and moisturize.
Love it. Yeah, skin is an important wrapper, isn't it?
It is. The other one I thought, early to bed, don't be late, get up early and vaccinate. Now you've got this madman, RFK, that even the whole Kennedy clan don't want to know. And, vaccinations have saved, and now we've got measles epidemics in America. And the articles are, can you diagnose measles? Well, I can because I started, but I vaccinated all my patients, etc. And so you've got to be proactive medically.
Okay, listeners, Proactive Medically, we're putting the lists of what's going to kill you in downloadable form and the 20-item test you should be asking your doctors for. Mileham, thank you so much for your, I love this, very commonsensical, data-driven approach. Let's cut the crap and get healthy, proactively and responsibly.
Thank you.
Thanks for sharing with us. And, to your next decades, I'm curious to see how long this regime will keep you going and role modeling for us what Q4 should look like.
Yes, well, I've got a vested interest too.
Exactly. See you soon.
I hope so. Bye-bye.
Bye-bye. For more thinking about the impact of our 4-quarter lives, you can read my column at Forbes and subscribe to my Elderberries newsletter on Substack. Let's design lives that aren't just longer, but better.